We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. On August 3rd, the Nova Scotia Health Authority announced 16 new doctors would be coming to Cape Breton. Mr. Speaker, it turned out that information was simply wrong. Among other things, they counted 3 doctors who had arrived over a year ago and had already been announced. Mr. Speaker, clearly we have a government that is more interested in political spin than actually providing better health care to Nova Scotians. So I'd like to ask the Premier, what is he doing to ensure that the information Nova Scotians get about their health care is accurate?
The Honourable Premier.
Speaker, I want to thank the Honourable Member for the question. Mr. Speaker, as you would know, we've committed to continuing to work with communities across the province. The Minister of Health has been travelling across the province, meeting with healthcare providers, meeting with community organizations, meeting with communities who have invested their time, money and energy in ensuring that their healthcare facilities in their community are there and up and running and vibrant, and the Minister will continue to work with all of our partners to make sure that the appropriate healthcare team is in place.
The Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, Nova Scotians can have no faith in that answer when the agency that's been designed by this Premier to deliver health care gives them information that is simply wrong. In fact, that press release that announced 16 new doctors was shredded. Its credibility was shredded by Dr. Mike MacDonald of Cape Breton in a letter 2 days later to the Cape Breton Post, where he pointed out not only the 3 doctors that had already been counted, but that another, in fact, had not signed a contract yet, and still another wasn't sure he was going to go to that area at all, Mr. Speaker, and yet a government press release went out claiming 16 doctors when in fact it wasn't true, Mr. Speaker. How can Nova Scotians trust this government to deliver health care when they are not accurate with the information they provide to the people of Nova Scotia about their own system?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank all those healthcare providers, Mr. Speaker, out there working with our government, working with the Minister of Health to make sure that we deliver health care, the quality health care that Nova Scotians have come to expect and deserve. And we'll continue to work with all of our partners to make sure, Mr. Speaker, that we have the health care team in place.
The Honourable Leader of the Official Opposition on his final supplementary.
Well, Mr. Speaker, we should certainly thank Dr. Mike MacDonald for being truthful with the people of Nova Scotia with what's really going on with health care in Cape Breton, rather than defend a press release that played on the hopes of the people of Cape Breton for better health care, Mr. Speaker, that was nothing more than political spin. The Premier gets up and defends that. Well, Mr. Speaker, that is not good enough. Will the Premier now admit the truth? Our health care system in Cape Breton is in crisis and take the right steps to fix it instead of defend the indefensible.
The Honourable Premier.
Speaker, again, I want to thank the Honourable Member for his question, Mr. Speaker. I'm very proud of the work our government has done with the people across this province, continue to invest in health care. The Minister of Finance will stand on her feet next Tuesday, tabling our budget. We'll have an investment in health care. And I'm really grateful for the people of Nova Scotia who gave us an opportunity to have a second majority in this province.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, back in May, in the course of the election, I had the opportunity on a number of occasions to ask the Premier whether or not, in his view, there was a crisis in Nova Scotia health care. And on every such occasion, the Premier indicated that, in his view, this was not the right way to be characterizing the health care situation in Nova Scotia at the moment. And yet, according to Statistics Canada, since this government took office, the proportion of people without a family doctor has gone to 13% from 9%. And so I want to ask the Premier now, are you willing now to admit, is he willing now to admit that there is a healthcare crisis in Nova Scotia?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. I want to thank all those community members across the province who are working with our government to ensure, Mr. Speaker, that the healthcare teams are in place in their communities. We know there are pockets in this province where physicians are required. We know there are pockets where we need more nurses, Mr. Speaker. We're continuing to work with those communities to make sure that the healthcare that they deserve and require is in place.
The Honourable Leader of the New Democratic Party on his first supplementary.
Mr. Speaker, in August, 2 residents of Halifax-Chebucto, Teresa and Walter Zukaukas, learned that they would be losing their doctor in early November. Mr. Zukaukas was diagnosed with Parkinson's disease in 2010, and since then he's had 3 different family doctors. He's on 9 different medications at any given time. uses a wheelchair and received home care 7 days a week, but he needs a medical professional to monitor his condition. Mr. Speaker, the Zoo-Caucasus have demonstrated significant medical need, but cannot find a doctor. Does the Premier not believe that their circumstances constitute a crisis?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. As we know, there are families across the province who are looking for and require a health care team. Mr. Speaker, a family physician, we know when those families are, the anxiety that families feel when they not have the access to that primary care. It's why we're continuing to work with our partners very hard to ensure that we have in place the appropriate health care teams to be able to provide care to those families.
The Honourable Leader of the New Democratic Party on his final supplementary.
Yesterday, All Nova Scotia reported that doctors in this province have all but lost confidence in this government. According to a Doctors Nova Scotia report also published yesterday, consultations held with doctors at 29 separate meetings around the province found that doctors are burning out and that patients, as a result, are suffering. The president of Doctors Nova Scotia speaks of the situations having reached, these are his words, their words, a tipping point. And so I find it entirely reasonable to ask, if this is not a crisis, I wish to ask the Premier, then what is?
The Honourable Premier.
Mr. Speaker, again, I want to thank the honourable member for the question. I want to thank those healthcare providers across the province who are continuing to work with our government to ensure that the appropriate health care is in place in communities across Nova Scotia.
The Honourable Leader of the Official Opposition.
Mr. Speaker, wait times for adult mental health services have taken another big jump on Cape Breton Island. In May, the average wait time for mental health services was 354 days. That's almost a year, Mr. Speaker. Today, that number has jumped again to over 425 days, and I'll table the government's own report that proves it, Mr. Speaker. I'd like to ask the Premier a simple question. Why do Cape Bretoners have to wait 425 days to get the mental health services that they need?
The Honourable Premier.
Speaker, that wait time is too long, and we're going to continue to work, Mr. Speaker, with our healthcare providers to ensure that every Nova Scotian who requires access to mental health services are going to get it, Mr. Speaker.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, we have been bringing the crisis in mental health service delivery to this House for over 3 years now. The government has acknowledged it's a problem for over 3 years now. The Premier continues to rehash the same promise that someday they will actually do something for the families that have a family member who is a mental illness, who may be in crisis, Mr. Speaker, but the wait lists just go up. Mr. Speaker, I'd like to ask the Premier why, in the face of such evidence of hardship in our mental health system, has this government failed to act to help families in mental health crisis?
The Honourable Premier.
Mr. Speaker, I want to thank all members of the question. I also want to thank Dr. Stan Kuchar, who's been working very hard with our government to ensure that we go in and identify the challenges being faced in communities across the province. He's raised recommendations. The Minister of Health is implementing those recommendations. We know there's still more work to do. We're going to continue to make those investments. As the Minister of Finance stands on her feet next week, there will be additional investments in healthcare, and we're looking forward to continue to work with our partner, because I agree with the honourable member that wait list is too long. And we need to continue to work with all of the healthcare providers to ensure that we bring that wait list down.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Health. Mr. Speaker, people are talking in Waterford. They've seen cuts to services in their community over the years. They're worried that the cuts aren't done yet, Mr. Speaker. While the Minister has said he's committed to improving health care, we haven't seen much evidence of that where I'm from over the last 4 years. And my constituents are worried that the situation we're in right now will only get worse. The combination of emergency room closures, staffing shortages and removal of services has people in Waterford feeling nervous about the future of healthcare in our town. Mr. Speaker, all summer the Minister has not responded to my requests for a meeting. Now that we're face to face, will the Minister of Health and Wellness give me his word that no more frontline healthcare services will be removed from Cape Breton Centre?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'd like to thank the member opposite for the question. As she would know, Mr. Speaker, as part of my work in the first few months in my role as the Minister of Health and Wellness, it's included a tour of the province, meeting with frontline healthcare professionals, touring facilities, practices and so on, and that included a visit down to the New Waterford area to visit the facility, have those conversations, to hear firsthand from people within her community. Thank you, Mr. Speaker.
The honourable member for Cape Breton Centre.
Mr. Speaker, in June of this year, I wrote to the Minister of Health to express my concerns about the future of New Waterford Consolidated Hospital. After a year of many emergency room closures, the mobile care team was taken off duty for the summer, and nursing staff were reassigned to the regional hospital in Sydney. It is now September, and as of last Friday, the summer nursing schedule has been extended until January 2018, leaving people in my riding without access to the emergency health care that they need. Mr. Speaker, I'd like to ask the Minister of Health and Wellness whether residents of New Waterford should expect their closure, the hospital to close permanently, or if he can guarantee that we will not lose services at the New Waterford Consolidated Hospital.
The Honourable Minister of Health.
Mr. Speaker, what I can assure the member opposite and members of her community is that this government, through our partners and through the Nova Scotia Health Authority, the IWK and other healthcare providers throughout the province will continue to work diligently to provide the necessary services in the healthcare system. That includes, Mr. Speaker, emergency services, making use of the resources within the community, within New Waterford and throughout Cape Breton and the rest of the province, Mr. Speaker, to ensure we can provide the best services to the people of Nova Scotia that we can. Thank you, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. Mr. Speaker, the federal Liberal government is planning a massive tax grab on the small business owners of the province of Nova Scotia and indeed the entire country. Mr. Speaker, the federal Liberals have labelled our own employers here in Nova Scotia as tax cheats, as people are owed to not pay their fair share, Mr. Speaker, instead of recognize them for what they are, which are the people that make our economy grow. In the face of this pending hardship, our Premier has had nothing to say publicly, Mr. Speaker, to defend Nova Scotia employers. Obviously, the Premier is putting the needs of the Liberal Party ahead of the needs of small businesses here in Nova Scotia. I'd like to ask the Premier, why is he staying silent in the face of such a massive tax grab against Nova Scotia small businesses?
The Honourable Premier.
Speaker, I want to remind the honourable member that Nova Scotians have decided that I haven't remained silent on their issues for the last 3.5 years and give me the privilege to stand here again.
Order, please. The Honourable Premier.
Thank you, Mr. Speaker, and I want to again remind the honourable member, as I worked not only with this federal government but the previous federal government, I've had many discussions with senior members of both governments, Mr. Speaker. The only difference is, unlike the honourable member...
Order, please. The Honourable Premier.
The only difference is, unlike the honourable member, Mr. Speaker, I don't run for a microphone to disclose every conversation I have.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the people of Nova Scotia, as much as it pains me to say this, did put that Premier in that Premier's chair, and they expect him to stand up and defend them. They expect him to stand up and defend them when they are called tax cheats, when they are made to feel like they're doing something wrong because they're employing fellow Nova Scotians and making our economy grow through our small businesses, Mr. Speaker. He can defend the backroom deals that he makes as much as he wants, but people want to know where he stands. Does the Premier support the federal tax changes, yes or no?
The Honourable Premier.
Mr. Speaker.
Order, please. The Honourable Premier.
Thank you, Mr. Speaker. Nova Scotians know where I stand. I stand directly with them.
The Honourable Leader of the Official Opposition.
Well, no, Mr. Speaker, they don't know where he stands on this very important issue because he won't say. What they are beginning to realize is that when given a choice between supporting the Liberal Party and its needs and supporting the small businesses owners of Nova Scotia, he supports the Liberal Party. And that is not right, Mr. Speaker. That is not right. Our economy is at risk. 40 different small business groups have written to this Premier and asked him to speak up, and yet he has not. So I'd like to ask the Premier, why won't he say publicly now that he's against the small business tax changes that the federal Liberal government is imposing on Nova Scotia businesses?
The order, the Honourable Premier.
Mr. Speaker, I want to correct the honourable member. That decision has not been made. Whether or not that tax changes that he's referring to will be implemented, there's an opportunity.
Order, please. The Honourable Premier.
Opportunity, Mr. Speaker.
Order, please. The Honourable Premier.
Mr. Speaker, there will be an opportunity for all Nova Scotians to express how they feel about those changes, whether in favour or against. I'm taking that opportunity, Mr. Speaker, at the highest level in government to express the position and concerns that have been raised to us by not only small business owners in terms of those that are out there, but our healthcare professionals that are in who have expressed their concern. We're making those expressions on their behalf to the federal government, and I look forward to continuing to do that, and we'll see what happens, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, apparently the Premier does have a position on this, but it's a secret position, and Nova Scotians aren't allowed to know what it is. Every Nova Scotian has the ability to provide their input, but they are not allowed to know what the Premier himself thinks of these federal Liberal tax changes. That is a bizarre and ridiculous position for the Premier of Nova Scotia to take. You know, Mr. Speaker, it is not lost on the small business owners here that this tax grab won't only benefit the federal government, but that the provincial government will get a windfall in new taxes as well. So I'd like to ask the Premier, how much money is his government going to make if these tax changes go through?
The Honourable Premier.
Mr. Speaker, I want to tell the honourable member that may be how he's focused on this issue, Mr. Speaker. That's not the position that we've taken as a government. There's a broader issue, Mr. Speaker, when it comes to the impact this will have. We've heard very clearly from doctors across the province the impact. I've heard from small business owners, Mr. Speaker, the impact that this would have on their businesses, and we're communicating that to the national level, Mr. Speaker, and we're going to continue to do so.
The Honourable House Leader for the Official Opposition.
Well, thank you very much, Mr. Speaker. This government made a lot of empty promises about improving health care during the last election. Now, you know what? We welcome any and all initiatives that improve the health and wellness of people of this province, but we believe it should receive accurate information. In the 2017 Liberal platform, it reads, "We have increased funding by $8.1 million each year as a part of a long-waiter strategy," and I will table that document. Yet according to every budget address tabled by the Liberal government, number one, those numbers are wrong, and I'll give you table number 2. So my question to the minister is, will the minister be sure to provide accurate figures going forward and not use campaign-style rhetoric to conform or comfort Nova Scotians waiting 3 and 4 years for surgery?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member opposite for the question. You know, Mr. Speaker, we continue to recognize that we need to do things more efficiently in our healthcare system. That process to improve the services to Nova Scotians, including in the area of surgery, may require doing things a little differently, but it may also require more investment, Mr. Speaker, and I ensure Nova Scotians, the member opposite, that we continue to move forward in that regard. But, Mr. Speaker, when it comes to accuracy of information being presented, Mr. Speaker, I'd encourage the member to be cautious with throwing rocks in a glass house. I'd like to table this message where a statement out of that party referring to factually incorrect information that was not included as part of the release from Mr. Don Mills of CRA. Thank you, Mr. Speaker.
The Honourable House Leader of the Official Opposition on his final supplementary.
Well, you know what? It's a good thing we have an Auditor General in this province, a person that can look at everybody's documents and make sure that they're correct. The Auditor General reported that the department is aware of at least $35 million be needed in upfront to address the wait list for orthopedic surgery, and I will table that. The Auditor General pointed out a series of weaknesses in the planning by the department and the failure to deliver on certain planned programs. Mr. Speaker, my question, which documents should Nova Scotians believe? The 2017 Liberal campaign platform or the Auditor General?
The Honourable Minister of Health.
Thank you, Mr. Speaker. What I'd like to assure the member opposite, and indeed all Nova Scotians and members of this House of Assembly, Mr. Speaker, that of course the work that we're going to continue to pursue, the work that we've done in the past, and in improving the number of surgeries, doing more surgeries, orthopaedic surgeries across the province, Mr. Speaker, making changes to ensure that people of the province of Nova Scotia can receive services, including surgery services, not just in their local region, but where wait lists may be shorter in other parts of the province, Mr. Speaker. Those are the steps we're taking to move forward to help address this issue. Thank you.
The honourable member for Dartmouth South.
Mr. Speaker, my question is for the Minister of Education and Early Childhood Development. Mr. Speaker, last year the government completed a review of regulated childcare that included consultation with thousands of Nova Scotians. In the recommendations from that extensive review, there is no mention of pre-primary. Since the government started with the rollout of its pre-primary program, we have heard from families worried that they don't know if or when the programs will start, childcare providers who are concerned about losing staff, and centres that have lost space. I'm not sure where the fire is, Mr. Speaker. Mr. Speaker, does the minister agree with families and childcare providers that when it comes to programs for our children, it's more important to get things done right, not just to get things done?
The Honourable Minister of Education and Early Childhood Development.
Mr. Speaker, we have a problem in Nova Scotia. We know that pre-primary education, because of research, evidence, and other facts that have been presented by experts, is key to providing them a better start. It's linked to lower anxiety levels. It's linked to a better transition to an academic learning environment. It's key to screening for learning disabilities at a younger age so we can better prepare for those students. And only 25% of our kids, preschool age in this province, are accessing those critical programs, Mr. Speaker. While the opposition parties fight to maintain that status quo, I assure that member and every member in this House, we will move forward on an ambitious agenda because we have high ambitions for our kids.
The honourable member for Dartmouth South.
Mr. Speaker, I suggest that's an agenda that may come at the cost of childcare for all other ages in this province. And Mr. Speaker, one of the challenges identified by the 2016 review was the insufficient programming for children with diverse and special needs. When I wrote to the minister with my concerns about inclusion in pre-primary, the minister's response was that the children in those programs would have access to the same supports they would have in regulated childcare, and I'll table that. Mr. Speaker, is the minister aware that the review done by his own government found those supports to be inadequate more than 1 year ago?
The Honourable Minister of Education and Early Childhood Development.
Mr. Speaker, I took great interest in that member's comments earlier during member statements where she said we need to speak the truth in this House. That member has perpetrated things that are not true, misleading the public.
Order, please. Order, please. I'd like to remind the minister that we're getting into tricky territory there, implying other members are not telling the truth. The Honourable Minister of Education.
Here are the facts, Mr. Speaker. That member suggested that these pre-primary classes that we are working to implement are not inclusive sites for learning. That is absolutely and unequivocally false. These are inclusive learning sites that will support children of all diverse needs in our classrooms, Mr. Speaker, and I'm very excited to keep moving forward with our partners in the childcare sector. We have a vested interest in them. We support that sector to the tune of $55 million a year.
The Honourable Minister of Education.
Mr. Speaker, we have a vested interest in the success
of the Honourable Minister of Education.
Mr. Speaker, we have a vested interest in the success of our childcare sector. We invest in that sector to the tune of $55 million a year. We are in negotiations with the federal government that will see additional funds for that critical sector. I share the same goals as the folks in that sector, that all students, all children in Nova Scotia have to have access to these programs, which you know will have a positive impact on their lives.
Thankfully, the Honourable Member for Colchester, Musquedobbin Valley.
Thank you, Mr. Speaker. My question is for the Minister of Health and Wellness. Earlier this week, we've all heard of the horrible tragedy that happened in Tatamagouche. As details of the incident are coming out, one aspect of that tragedy is the alleged failure of our healthcare system in addressing mental health. I know all members of this House take issues like this very seriously. We have to ensure the system is not failing Nova Scotians. My question is, has the Minister launched an investigation as to the healthcare services? Were they adequate or not adequate in this particular situation?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and thank you to the member for raising the question. Of course, Mr. Speaker, the situation in which he refers to is a tragic situation, and I believe it's fair to say, on behalf of all the members of the Legislature, that our hearts go out to those families and the community affected. What I would like to highlight and caution the member, of course, though, is that this is a situation which is an active investigation ongoing towards the incident and allegations around it. So, Mr. Speaker, it'd be inappropriate to speak to details while such an investigation is ongoing. Thank you.
The Honourable Member for Colchester Musquedominant Valley.
Thank you. I'm just happy that the investigation is taking place. In Cape Breton, we know there have been several heartbreaking stories from families who have lost loved ones to mental illness. Last year, another incredibly sad story emerged in the Upper Big Tracadie and the loss of an entire family. Anything that can be done to prevent these struggling with illness, mental illness, from escalating and hurting themselves or others is certainly essential. Will the Minister commit to addressing any gaps in service or weaknesses in the system that can be identified by staff or by doctors?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And again, a very tragic situation, one that hits particularly close to home, literally speaking, Mr. Speaker, from my own situation there. Mr. Speaker, of course, I can assure the member and all Nova Scotians that the area of mental health and opportunities to improve the services across this province are indeed a priority. It is very important to us, Mr. Speaker. We know that 1 in 5 Canadians do suffer from mental illness throughout their lives, Mr. Speaker. Very important that we work to support those family and community members and our friends throughout this process, and the healthcare system is part of that. Thank you.
The Honourable Member for Cole Harbour Eastern Passage.
Mr. Speaker. Mr. Speaker, my question is for the Minister of Health and Wellness. Last month, I met with the Department of Family Medicine to discuss the fact that my constituency of Cole Harbour Eastern Passage doesn't have a single family doctor. I recently received a letter from Dr. Rick Gibson, which followed a meeting that we had, and I'd like to table that. I recently received this letter that stated that the Department of Family Practice would only support a physician who chooses to practice in our community if there's also physician cross-coverage ensured. My question to the Minister is, why is this government making it more difficult for our community to recruit a family doctor instead of easier when so many Nova Scotians don't have access to primary care?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and thank you to the member for the question. You first acknowledged the first question in the Legislature. Congratulations. But, Mr. Speaker, with respect to the area of family physician recruitment, Mr. Speaker, work is ongoing throughout the province for recruitment. We'll continue those efforts led by the Nova Scotia Health Authority. Mr. Speaker, we heard loud and clear from physicians throughout the province that indeed the intentions of the recruitment process to identify the most acute areas, the areas that were most in need, to prioritise those areas, Mr. Speaker, was not sufficient. That flexibility in working with physicians to identify communities they want to work with, and we're committed to allowing that to proceed. Thank you, Mr. Speaker.
The Honourable Member for Cole Harbour Eastern Passage.
Mr. Speaker, it appears from the letter that I tabled that the people from my constituency must not only recruit one family doctor, they also have to find somebody else to cover for that doctor if they're on vacation or take a professional development day. At a time when our government should be knocking down any barriers that prevent a doctor from servicing my community, they appear to be putting up more and more roadblocks. My question, Mr. Speaker, to the Minister of Health, will the Minister commit today in this Legislature to working with me and my constituents of Cole Harbour Eastern Passage to secure at least one family doctor rather than working against us? Thank you, Mr. Speaker.
Minister of Health.
Mr. Speaker, what I can assure the member opposite, and indeed I think perhaps even more importantly all Nova Scotians, Mr. Speaker, that in my role it's important that I work on behalf of all Nova Scotians to work with them, with the Nova Scotia Health Authority, the IWK and our healthcare partners to ensure primary care services are provided throughout this province, Mr. Speaker. We made it very clear in our platform commitments that primary care services and improving those across the province is a major commitment, Mr. Speaker. I've been tasked with leading that on behalf of our government and all Nova Scotians in my role. Thank you.
The honourable member for Cumberland North.
Mr. Speaker, nearly 3 years ago, this question is to the Minister of Health. Nearly 3 years ago, the former Minister of Health and Wellness announced this government would proceed with implementing an acquired brain injury strategy. Unfortunately, several years and deadlines have gone by with no progress. This inaction has left thousands of Nova Scotians wondering whether the government is listening. I have a young man in my constituency who's 22. He has been prescribed physio 3 to 4 times a week and has received one treatment since May. This is not acceptable to him or others like him. Question, will the Minister of Health and Wellness provide a timeline for the implementation of an acquired brain injury strategy?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question again, and another first congratulations on that. Mr. Speaker, with respect to the acquired brain injury strategy, I'd actually like to acknowledge the work of my colleague, the former Minister of Health, current Minister of Community Culture and Heritage, for his work and leadership throughout his term in office to, for the first time ever, put the acquired brain injury initiative, working with acquired brain injury. No, was it? Okay.
Order, please. The Honourable Minister of Health.
All right. Mr. Speaker, the work that he did with the Acquired Brain Injury Association of Nova Scotia to produce a report that came forward late in 16, Mr. Speaker, I've been working and had recent meetings with the ABANs, the Acquired Brain Injury Association of Nova Scotia, to discuss with them the results of that report. Thank you.
The Honourable Member for Cumberland North.
Thank you, Mr. Speaker. The Brain Injury Association of Nova Scotia recently registered its disappointment with these unexplained delays in delivering a brain injury strategy. Unfortunately, our minister even admitted publicly that he hasn't had an opportunity to read the report. I will table the remarks. Nova Scotians are disappointed that our Minister of Health has not taken the time to read this strategy. Question, Mr. Speaker, is has the minister found time since that article to read this critical consultation report on acquired brain injuries, including the recommendations made to his government?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And I'd like to make the member opposite aware, and indeed those members of the public, particularly those interested and involved, patients and caregivers and those affected by acquired brain injury, Mr. Speaker, that indeed I have taken many steps since coming in, and the importance of this particular initiative. One of the first organizations that I met with, I reached out to the Acquired Brain Injury Association of Nova Scotia to meet with them very early back in August. Mr. Speaker, to discuss with them the report that was provided. Mr. Speaker, I was briefed on the report. I continue to read through in detail, Mr. Speaker, the report that was provided. But also, Mr. Speaker, after meeting with the Acquired Brain Injury Association of Nova Scotia, made some commitments to move forward on some initiatives that could be done, including ensuring that there's an acquired brain injury lens put towards some other initiatives taking place within the department. For example, in the
Order, please. Time allotted for the member's answer has expired. The Honourable Member for Cape Breton Centre.
Mr. Speaker, this question is for the Minister of Labour Relations. Mr. Speaker, 1 month ago on August 22nd, the Liberal government proclaimed the Public Service Sustainability Act. The day the bill was proclaimed, the government announced that they would send the sections of the bill to deal with the wage pattern to the Nova Scotia Court of Appeal. My question for the Minister is, why did he not have the whole bill sent before the courts?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. We believe, Mr. Speaker, that the elements that we have advanced to the court are the basic principles of the argument, and we look forward to the outcome of the court's direction.
The honourable member for Cape Breton Centre.
Mr. Speaker, I am well aware that the government believes that they can ask the courts to rule what they deem to be the central question. But experts have raised concerns about the constitutionality of freezing the long service award, a benefit that was freely bargained for and agreed to in past negotiations. Mr. Speaker, if the minister is so confident that Bill 148 will pass constitutional muster, would he at least agree that he would have received a clearer answer for all Nova Scotians had he sent the whole bill to the courts rather than just a slice of it?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. We believe, and to my colleague's point, expert opinions vary. One of the challenges we face, quite frankly, is that often subject matters have opinions on both sides of the argument. We believe that the argument is grounded in the principles that we've advanced, and we look forward to the outcome of the court's direction.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. My question through you is to the Minister of Health once again. 11 months ago, almost to the day, I stood in this chamber and asked the previous minister about funding for home-based oral cancer medications. Funding that would provide patients the same coverage as facility-based treatments. And that minister, the previous minister, promised that he was looking into it. 11 months ago, Mr. Speaker, is literally quite a lifetime for someone suffering from cancer. Almost a full year later, does the new minister have any good news for patients who have been prescribed a home-based oral cancer treatment?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising this very important topic in the Legislature today on behalf of individuals across the province who are suffering from cancer and may be prescribed home or take-home or oral-based therapies. Mr. Speaker, I can assure the member opposite that I know firsthand that my predecessor, the current Minister of Community Culture and Heritage, did indeed take that issue very seriously. I know that as the former Minister of Finance, Mr. Speaker, and we're certainly did take that to heart. We made commitments in our platform, and you'll see us continue to move forward on that initiative.
The Honourable House Leader for the Official Opposition.
Well, the way I understand it, Mr. Speaker, that the previous Minister of Finance didn't give enough money to the Minister of Health at the time in order to do this. So let's hope that the new Minister of Finance gives the current Minister of Health the money to do this. So, you know what, Mr. Speaker, no news is good news, and if that's good news, I think most Nova Scotians would prefer no news. So we know that home-based cancer treatments reduce burden and stress on both the patient and the healthcare system, yet this government has refused to provide equal coverage to those patients who have been prescribed the form of treatment. Will the minister commit to funding or giving us an indication that maybe in the budget that's coming up in a few days that oral cancer treatments will be covered finally and fairly, equitably to our patients?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and again, thank you for the question. Mr. Speaker, I can certainly assure the member opposite that a great deal of work has been done, was done before I came into this position, Mr. Speaker. I'm proud to have the opportunity, the good work of my predecessor, and working with my colleagues to continue moving forward on this, Mr. Speaker. And as I said, I think Nova Scotians in the near future will see some progress on this important file. Thank you, Mr. Speaker.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Health. Earlier this month, Deputy Ministers of Health from across the Atlantic region came together to discuss a regional approach to pharmacare. Now, after how badly the changes to the Seniors Pharmacare program went over last year, it makes sense that this meeting should give us all reason to pause. This government has said time and time again that we will see consultations from one end of this province to the other before any changes are made to Seniors Pharmacare or indeed Pharmacare. So I'd like to ask the Minister today, what was the outcome of these meetings on a regional Pharmacare plan?
The Honourable Minister of Health.
Thank you, Mr. Speaker. You know, it's very exciting that an initiative that we certainly have been championing here in the province of Nova Scotia to bring this forward as an agenda item to work with our sister provinces in a collaborative initiative to advance really what would be a major enhancement and shift in the delivery of services in our provinces, Mr. Speaker. Indeed, I think it's interesting this morning talking about the role L&J played in making major policy shifts. Indeed, it's very exciting to be part of moves and discussions in that regard. Thank you.
The honourable member for Pictou East.
Mr. Speaker, I wish I could take comfort in the fact that this government is the one leading the charge. We've seen how they roll things out. So this government does not have a good track record on implementing major changes, particularly in our healthcare system, Mr. Speaker, and it does not have the best track record in consulting with Nova Scotians. We heard this government say time and time again it would consult with Nova Scotians from one end of the province to the other on changes to seniors' pharmacare. They haven't even started that. Mr. Speaker, they haven't even started those consultations, and now they're off chasing a new shiny object. I'd like to ask the minister today. Let's go back to seniors' pharmacare. Do you actually have any intention of consulting with Nova Scotians? And if so, when might you get around to starting it?
The Honourable Minister of Health.
You know, Mr. Speaker, I take a bit of exception to the suggestion that the member opposite made that we don't have a great track record with making changes in our healthcare system, Mr. Speaker, including the conversation about pharmacare and the seniors pharmacare program. There's 12,000 more Nova Scotia seniors that are not paying any premiums for their pharmacare in the province because of changes that this
Order, please. The Honourable Minister of Health.
Just in case the member opposite, Mr. Speaker, missed, I'll restate that that's 12,000 more seniors in the province of Nova Scotia.
Order, please. The Honourable Minister of Health.
In response to the pharmacare program, Mr. Speaker, 12,000 more Nova Scotia seniors not paying premiums for their pharmacare services in the province of Nova Scotia because of changes this government made, Mr. Speaker, and will continue to make positive changes in our healthcare system.
The Honourable Member for Kings North.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health and Wellness. On August 18, 2016, the Premier re-announced a new agreement between the Nova Scotia Health Authority and the Valley Hospice Foundation for the construction of a new hospice on the site of the Valley Regional Hospital, and I'll table that. During that announcement, the Premier said the residents of the Annapolis Valley have been working tirelessly for this project for over a decade, and soon their dedication will pay off. Well, Mr. Speaker, on April 5, 2017, prior to the election, the Premier visited Cape Breton and promised a new hospice, a provincial hospice policy framework to help the Hospice Palliative Care Society of Cape Breton negotiate with the province, and during that time reiterated the commitment to the Valley. My question for the Minister is this: when will the residents of the Annapolis Valley see their more than 10 years of effort rewarded with a shovel hit in the ground for the new hospice?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I appreciate the member opposite reiterating the commitments that have been made and the partnerships that we've entered into with groups like the Valley to move forward on a new hospice in that area, Mr. Speaker. The work that's ongoing in Cape Breton to provide them, well, we've provided them with the framework and discussions as to a proposal that they'd be bringing forward that would adhere to that framework, Mr. Speaker. Those works continue. As far as when a shovel hit a ground, Mr. Speaker, I'd have to check in with, again, project managers working on that project. Again, the commitment to move forward is there. That would be really a project-based process for that work, Mr. Speaker.
The Honourable Member for Kings North.
Speaker, if announcements counted for actual work, we'd be fine. The release that I tabled stated that construction would begin in 2017, and 2017 is 2/3 over, 3/4 over, and the hospice was supposed to be finished by 2019. Mr. Speaker, my question is, we have had a tender awarded in 2013. Has the design work tender, has that design work been finished, and will we see construction begin in 2017?
The Honourable Minister of Health.
Mr. Speaker, thank you again for the question. It's my understanding that both the design work has been completed and indeed a site has been selected, Mr. Speaker. So again, actual work on the initiative continues to move forward, and I look forward, as I believe the people in that community do, to seeing those shovels hit the ground as well. Thank you.
The Honourable Member for Dartmouth South.
Mr. Speaker, my question is for the Minister of Justice. On September 12th, Justice Ann Derrick rejected a request to have a young offender carry out the remainder of his sentence at an adult correctional facility. For over a year, this youth has been held in conditions described by Justice Derrick as social isolation, and I'll table that. She ruled that the youth should be returned to Waterville, where he can resume the intensive treatment he had been importantly receiving. Senator Kim Pate also weighed in on this case, saying that the fact that Nova Scotia correctional authorities have resegregated the youth in the face of Judge Derrick's decision is shocking. So I'd like to ask the minister, was he aware that this youth had been held in segregation for over a year?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. What's important here, Mr. Speaker, is that the health and safety of both offenders and staff are of paramount importance to our government. I want my colleague to know that we will respect the decision of the court. As we speak, correction services in the IWK are working on a plan to facilitate the expectations of the court.
The Honourable Member for Dartmouth South.
Thank you, Minister. Mr. Speaker, right now there is a national conversation happening about the use of segregation and close confinement in our justice system. Through an access to information request, our caucus has learned that the department has undertaken an internal review of its close confinement policies, and I'll table that. This is in contrast to the province of Ontario, which conducted an independent review and released the results to the general public. Mr. Speaker, advocates, the public and frontline workers deserve to be involved in discussions of how to improve our justice system. So I'd like to ask the minister, will he commit today to tabling the results of the internal review here in this House?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. One of the elements of that process is to gather information internally first and foremost to address policies and the existing circumstances. But as we evolve, Mr. Speaker, I'm more than prepared to share our findings with my colleague and members of this legislature to ensure that we are all informed and that we continue to prioritize the well-being of both our offenders and our employees who work in those facilities.
Hear, hear. The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, last Sunday, over 100 residents of the Northside area gathered to protest the emergency room closures and loss of doctors at the Northside General. The emergency room is supposed to be open daily from 8 to 3 and sees over 10,000 patients a year when it's open. When the emergency room closes, patients must travel over 30 minutes to an already crowded emergency room at Sydney, and that was never built to handle the patients from the North Side. My question to the Minister of Health and Wellness is, will the Minister of Health and Wellness commit today to restoring full emergency room services to the Northside General Hospital?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and thank the member opposite for the question. Obviously, Mr. Speaker, the priority of health care in the province of Nova Scotia for the people of the province is a priority, Mr. Speaker. We heard that loud and clear. I think, Mr. Speaker, over the years, all governments recognize the importance of providing health care to our population. We'll continue to expand our investments. Our platform, Mr. Speaker, made it very clear that we heard Nova Scotians, that we were prioritizing, particularly in the area of primary and emergency care, Mr. Speaker. So we'll continue with that work as we move through this mandate. Thank you.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. And this 8 to 3, Mr. Speaker, was supposed to be a temporary issue that was going to be corrected. So if this is a priority for this government, I hope that means, yes, he's going to go restore full emergency room services at the North Side. In 2014, lab services changed at the Northside General Hospital, and concerned citizens were worried about the change in the role of our hospital. Long-term care patients started occupying beds that were once designed for short-term care patients and patients recovering from surgery. Earlier this week, I checked that the Northside was advertising for renal dialysis and emergency room nurses, as well as 2 family physicians on the North Side. The citizens in the area deserve better service than the government has provided us. So my question to the Minister: when will the Minister of Health and Wellness come to the Northside General and tell the people of the North Side what the future plan is for our medical facility?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, as I mentioned earlier, the work of the province, throughout the province, for all Nova Scotians, including those in the north side and across Cape Breton, both industrial Cape Breton and the Strait region, Mr. Speaker, and indeed right across the province, is to continue to work to recruit physicians and frontline healthcare workers, including nurse practitioners and others that can support the services needed by the people of Nova Scotia, particularly in the primary care area, Mr. Speaker. This is an important area, and it's an area that requires work. It's ongoing, Mr. Speaker, and we'll continue that commitment, continue working with the people of Nova Scotia and our partners at the Health Authority and the IWK. Thank you.
The honourable member for Queens Shelburne.
Mr. Speaker, my question through you is to the Minister of Health and Wellness. During the election, this government promised to target funding for food budgets at long-term care facilities. Of course, it was the same government that stripped food budgets in the first place, leaving seniors with inadequate service. My question is, will the minister commit to immediately restoring the food budgets and long-term care facilities?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Thank you.
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to government.